Hi, this is Dr. Michael Brisman. I'm a neurosurgeon from Long Island, New York. I'm part of a neurosurgery group called NSPC Brain and Spine Surgery. I want to talk to you about brain meningiomas. Meningiomas are benign tumors that can arise from the meninges, which is the covering layer of the brain and spine. So they can really appear anywhere or almost anywhere within the brain, because the brain has a covering layer that kind of envelops in different parts of the brain and all different parts of the brain. So it can occur in lots and lots of different places. I mean, there's certain places that are more commonly associated, but it can really occur in lots of different places. These are almost always benign tumors. In rare cases, they can be malignant, and one might think about standard radiation or even chemotherapy, but that's really rare. They're almost always benign. Sometimes they're atypical and grow a little bit faster, but they're still almost always benign tumors. They're not uncommon. A lot of people have them and don't even realize it. And if you got MRIs on everybody, you would find a lot of people have a little tiny meningioma here or there. The issue with these becomes if they're medium or large in size. I mean, if it's very tiny and we find out about it, and more we find out about these incidentally on MRIs, then we can just follow them. And the best study for evaluating a meningioma is going to be an MRI with IV contrast or gadolinium. And the tumors usually light up and are solid white on the image. So if the tumor is small and not bothering anything, we usually just leave it alone. If it's very, very big, then surgery might make sense. And usually I limit the surgery to tumors that are really large, because there's real risk to surgery. Now, obviously, a tumor on the surface is going to be much easier to manage than a tumor that's deeper inside. I also think that when the tumors are adherent to nerves and important blood vessels, it's best not to try to aggressively scrape the tumor off those nerves and blood vessels. It's better just to leave a little bit of tumor, and we can always do focused radiation and get the remainder. So if the tumor is very big, it sometimes does need to be removed surgically. And this is done through a procedure called a craniotomy. We open up the head under general anesthesia. These operations can take several hours. People have to stay in the hospital a few nights. But this can be very effective and reasonable if the tumor is very large. Most tumors, can be treated effectively with gamma knife or superfocused radiation or radiosurgery. And I do these with a radiation oncology doctor, and these are outpatient. And these are much, much lower risk than a formal brain operation to excise or physically cut out the tumor. The focused radiation treatment is effective regardless of where the tumor is. If the tumor is on the bigger side or it's near something critical such as the optic nerves, we may opt to treat it over 5 sessions rather than 1. And there are some cases where if the tumor is very big, we might say, that tumor should be treated with standard focused radiation over 20 to 30 sessions. But that's uncommon. Most of the time, the treatments can be done in 1 to 5 sessions, and it's a very safe, low-risk way of treating it. Again, some tumors do need to be removed, and that can be done safely as well. But for most meningiomas, the gamma knife or the superfocused radiation is going to be the way to go. We monitor these either way with follow-up MRI images over time. If the person has developed seizures as a result of the tumor, sometimes we'll be putting them on a seizure medicine such as Keppra. But the good news is these are benign tumors and can usually be very successfully managed either with observation or with superfocused radiation treatments. And in rare cases, we actually do an open surgery, and those can also be very effective and can give good results. Thank you.